Hi everyone, and welcome to the video on intravenous injections in horses. Today I'm going to show you how to give an intravenous injection on my trusty steed here, Misty. So when you're wanting to give intravenous injections, make sure your vet knows what you're giving the horse, and it is actually prescribed to your horse. So when you're giving an intravenous injection, the jugular vein is the vein that we use to give an injection in horses. This is called the jugular groove, and Misty is actually a racehorse, so she has they're renowned for having beautiful veins. So when you're wanting to give an intravenous, you need to do what we call occlude the vessel. And to occlude the vessel, you just push your thumb down there. She has a beautiful vein here that pops straight up, so you can see that there, that's her vein. I'll just let it go and you'll see it drop down, and all the blood flow goes back to normal. So occluding the vessel, or just pushing your thumb in, makes it pop up. Hers is massive. You can see most horses are about the size of your index finger, but Misty's is probably about 2 of my index fingers there. So when you're going to give an intravenous injection, if the horse is not Hendra vaccinated, it's always great to just protect yourself with protective gear. And I'm just going to put some gloves on. This mare is Hendra vaccinated, so I'm not too concerned about catching Hendra from her, but I'm just going to put some gloves on just to keep myself clean. Okay, so normally you'll have someone holding your horse. This girl, I know her like the back of my hand, so she's very quiet, but it's best to have someone hold the horse. And what I tend to do is I actually remove the needle from the syringe, because it's much easier to put it in when they're separated, but don't touch the end of that needle because we need to keep it sterile. So what you do is you take the cap off the needle, occlude the vessel. Now the best place to inject is the mid-third of the neck. So the bottom third of the jugular vein actually dives down and goes a bit deeper. And then the top third, it runs very close to what we call the carotid artery. Now arteries and veins are different. Arteries, if we inject into the artery, it goes straight back to straight up to the brain, and drugs straight to the brain can be a problem. So the vein's going back to the heart, and then it goes round the system and comes back. So we want to do it in this mid-third of the neck here. So again, I'm going to remove my needle and syringe. I'm going to hold it up. Now the most painful bit is actually going through the skin. So when you're going to do this, you need, I don't know if you can see that, but this needle has a bevel, which means it angles, one part is flat and then it has a bit of an angle on it. You want the flat part of the needle to go against the horse. So I've got my position right, I occlude the vessel, and then I'm just going to go straight in. Not worry about if I'm in or not, but the skin is the most painful part. And then once the horse has settled down, Misty, I then go in, and she's actually not going to give me, so when she shakes I stop. So I'm not going to get a flashback, but I know I'm in there. So when I put the needle on, I attach it, the syringe, and then draw back, and I've got blood. So then I inject, hoping that my horse stays still. If she moves, I inject. I pull back a bit and make sure I'm still there, and then inject again if she moves. And then once I'm done, I let go, pull everything out, and just put my finger over that spot there. And that's intravenous injections. The other thing to be careful of is to make sure where you're positioned. Sometimes horses don't like needles and they'll try to strike with their front legs. So making sure you're to the side so that if they do strike out, they're not going to get you while you're concentrating on getting the vein. Thank you for joining us. Bye.